From breakthrough strategies to game-changing innovations and cultural shifts, you'll discover the lessons that drive real impact, and we'll dive into the moments that changed everything. Welcome to The Missing Piece with April Reed. Today, I'm joined by Patrick Palma, a nationally recognized clinical informatics leader and National Director of Clinical Informatics at Covenant Living Communities and Services. Patrick is a trained informatics nurse specialist known for being both team-oriented and a natural change facilitator, helping organizations standardize and optimize clinical workflows in ways that measurably improve outcomes for both clinicians and patients. With a background that spans epic implementation and optimization, enterprise-wide informatics strategy, and training design and delivery, Patrick brings a rare combination of frontline, clinical insight, and system-level execution. He's also shaping the next generation as a professor and adjunct faculty in healthcare information systems and informatics. And he's a published voice on the future of care, including the evolving role of telehealth. Patrick, welcome to the Missing Piece podcast.
Thank you for having me. It's exciting to be here.
Good. I'm so excited to jump in. And I know that was quite the introduction, but I'm really excited to kind of dive deeper. How did you even get into this field? Take us back to the beginning. Who are you? Introduce yourself, and how did you get to where you are today?
Absolutely. Born and raised in the area of Chicago is what we'll call it, the north suburbs of Chicago. But healthcare has always been something, I guess, ingrained in me. It's maybe genetic. Interestingly enough, nursing was not my primary focus at all. All throughout high school, grade school, middle school, everything, I wanted to go into healthcare, but I didn't know exactly what. And the first thing that popped up was, I'm going to be a doctor. Let's be a doc. Let's do things in that field. I don't know exactly what, but that was my goal. And my first year of my college education, that's exactly what I was going for. But then my now wife, then girlfriend, was like, you know what? You might be suited for a career in nursing, and it could be a stepping stone to med school. Let's give it a shot. So I did switch schools, switch universities, and moved into a nursing program in which I found to be more of a calling, if you will. I know we say that a lot, but definitely more of a calling than being a physician would be. Nothing against physicians. It's just felt like nursing was a little bit more of my lane. And I ended up, doing decently well in it, and something that I definitely fell in love with, and started my career in the emergency department. And trauma level 2, dealing with all the things you could think of from a bedside perspective, including the idea of documenting. I've always had a little extra piece to me of technology, wanting to be in tech, not necessarily programming, but being a voice to say, hey, wouldn't it be better if, right? It's that question of if. And one thing that I tended to do a lot in the ED was find ways for the electronic health records, the different tools we use, to work for me. Right. We have evolving technology everywhere. It's consistently changing left, right, up, down, diagonally. And it's kind of tough to figure out how we can go about using it. And instead of trying to adjust to the tech, I've learned to have the tech adjust to who I am, how I worked. And it led me to think, I'm like, how could I do this at a greater scale? Make a bigger imprint in the sand, if you will, when it comes to impacting the technology change. And interestingly enough, fun story, although really not fun, but this is true. Walked into HR one day. I needed one of those new badge reels, the ones that snap back. And I see a magazine that says Nursing Informatics. Had no idea what it was. Next thing I know, I get home. My wife says, I signed up for a master's in nursing education because, quick news, she's a nurse as well. And she said, there's this thing called informatics. I think you should sign up for it. It sounds cool. That was a sign. So instead of thinking of making my way towards med school, I did sign up for a master's program in nursing informatics, finished that in 2013, and have been doing it since. Worked on Epic teams for about 8 years in acute care facilities until LinkedIn, powerful tool that it is, Covenant Living found me and asked me and hired me to be the new inaugural, very first position as the National Director of Clinical Informatics. And in the senior living realm, it is a bit of a rare sight to see someone that has an informatics title. Again, that's what I've been doing ever since, is really trying to find ways to impact more patient outcome by helping nurses, right? On a given shift, 4 patients at a time. in a given year that I'm doing informatics, I mean, every day that I can make something better for a nurse, you're impacting that many more patients. So that's the bigger, that's kind of the short of the big picture, if you will, of who I am.
That's incredible. So for those that are in nursing school and or even studying healthcare IT, what would you tell them about informatics? Like you are saying, I don't even know what this is, to now you're a national director for it. How do you dumb it down for your students or for whatever? And it's not even dumbing it down. Like, how do you introduce them to this world of informatics?
Yeah. Yeah. It's informatics. The idea behind it is to impact system change so nurses can do better, so doctors can do better, right? We have an evolving world of complexity. As our aging population ages even more rapidly, we're going to be seeing more acuity, more numbers, and to be quite honest, a dwindling workforce. So how can we then leverage technology to be something like a tool belt? So I say this a lot within the sessions I hold on Wednesdays for my students. A lot of the informatics tools we have are kind of like your utility belt. You have a stethoscope today to use to listen to lung sounds, heart tones, and whatnot. Think of the informatics tools as a way for you to digest the data so you can make better decisions. It is a tool for you to do better. And it's a great way it's really a bridge to connect the two worlds of IT and nursing. I've always said IT guys or IT gals and nurses, they just don't talk in each other's language. And it's very difficult for them to understand one another. Think of yourself as the translator, creating a bridge that creates that continuity of care across the board.
Yeah, I love that. I think you actually said that like beautifully. I mean, I come from the implementation side of specifically EHRs and training. And it's like the EHR got put in by the IT department and then deployed by the IT department. And they're expecting the nurses and the doctors to then use the application.
Right.
And to your point, they're not talking. And it starts to become, and then everybody's like, well, I built it perfectly. And then now we have to go back and customize, et cetera. So I love, how you're saying there is a bridge and the goal is to improve patient care. I mean, at the end of the day, so how do we do that? And I love that say, okay, technology is powerful, but how do we then spin it over to the patients?
Right.
I mean, to the clinicians and to the providers that are actually caring for these patients. I love it. I love that. That's awesome. So I call the podcast The Missing Piece because there's sometimes aha moments or places where, there is a missing piece that changes everything for you. Or in your life and in your career. Do you have something that comes to mind right away? I mean, obviously it was that moment where you saw informatics and then your wife saying, I think you should pursue informatics. But is there anything else that comes to mind when you're saying, okay, this was a missing piece that helped move the needle for me, or even in your career coming over to where you're at now?
Honestly, at the education of it. The idea of informatics is, I guess, the nursing informatics specialty was seen as a specialty in the 90s. It sounds like a long time ago, but in reality, if we take all of healthcare, it's quite new. And I think for me, it was me being someone who was a little bit more technology forward and just a little bit more excited to do it. It was the idea of wanting to make it better. Yes, you are right. There was a sign between the HR visit and then also with my wife when I came home. But for me, it was just this desire of seeing nurses struggle with their documentation. I remember and recall shift after shift after shift where I would be completely fine with documentation because I learned how to make it better for me. But 80% of the nurses, at least from when I was at bedside, didn't know how to do that. And I think it's because of that quote unquote language barrier between the technology and the nursing staff on how can you use me? How can you use the technology to do it better? So initially it sounded like an educational piece, right? Initially I'm like, well, maybe it's an educational piece. Maybe I just need to help them and train them on it. And then I'm like, well, maybe it's not that either. Maybe what's missing is the fact that a lot of the design is not intended for the audience that it's being designed for. So it's like, well, lo and behold, here I am. I'm a nurse. I've walked the walk. I've walked in the shoes. I've worn the stethoscope. I've worn the scrubs. So I understand it. And for me, it was the missing piece is really the nurse in the idea of technology design, implementation, training, and support. And I felt like that was more or less it. And as I looked for the education and found that it actually existed, I'm like, here we go. Here's the moment where we're going to start to see kind of the market change where nurses aren't only just doing, hey, I'm going to be a nurse now, I'm going to be a nurse practitioner next, right? That's a very common path we see from a nursing perspective. We rarely saw nurses going to quote unquote the dark side, right? That was always how it was seen, as like nurses never really go to the IT side or follow down that path. And as the education showed with my master's, hey, there is a program out there. I think we're going to see a shift in the market. And we have since then, right? We're starting to see the informatics realm, nursing informatics as a whole, saturate itself with more nurses wanting to go in it because they're seeing the impact nursing can make in the tools that we use. A multitude of things really for me that was missing was the fact that I didn't know education existed. I didn't even know it was a specialty. And then all of a sudden the line just shed on all of it, saying, here are all the things that I need to make a career out of it. And it's been successful so far.
Isn't it interesting that you're saying, like, even back in the 90s, and yes, it does seem like a long time ago, but at the same time, it doesn't. I mean, EHRs were mandated by our president in January 2011. Like, that's it. Like, it wasn't that long ago. Up until then, people were still, majority was using paper records. How do you think, you had mentioned, we've come a long way, but do you still feel like we have a long way to go in catching up to the power of clinical informatics, as a whole nationally? I mean, obviously here in your seat and as a national director, like, I'm sure you're crushing it, but what about everybody else? I'm just curious your pulse on that and your thoughts. Very curious.
Long way to go. For sure. And I think that distance, if you will, does change depending on the particular portion of the market, right? In the acute care world, there's a lot more of a focus on the idea of technology. It's definitely been adopted by them more. And you're right. I think it was a State of the Union address by George W. Bush, right? I think it was his administration that put it out there, that indicating we want a certain amount of U.S. citizens to have an electronic record. And as the administrations went on, there were continuing efforts to continue to do that. And a lot of that was acute care focused, right? Mm-hmm. Hospitals, medical groups, and they have a lot of power and a lot of technology that they use. And I still think they're behind, right? We are seeing an adoption of artificial intelligence in our personal lives and even in the educational world that's just booming. We had telehealth well before the pandemic, the COVID-19 pandemic, focused on the behavioral health market. But as we're starting to see the need to shift how we utilize these tools, I think we're starting to fold into it and say, we need to catch up. We are nowhere near where we need to be. I definitely think we need more of that clinician input, the nursing input, to find out and strategize ways to catch up. And when we do catch up, we won't be caught up, right? Because that's just how technology rolls. In the senior living market and where I work, I think we're even further behind. And I think it's because the adoption of the idea of informatics was done much later. As I said at the beginning, the national director's seat that I sit in for informatics is an inaugural position. I am the first and still here. You do not see a lot of direct informatics roles in the senior living market because it was just not seen as a needed thing. And here we go. Our skilled nursing facilities, their level of acuity is changing to the point where it's getting harder. It's more severe. And the assisted living market is becoming a little bit more like a skilled. So we need to find ways for technology to help them as well. We're just a little reluctant in wanting to trust in a lot of that technology. And I think it is because there is this fear of it's going to take over. If we release that and say, if we can design it to work as a tool rather than a replacement, I think we're going to find a much better path forward in adopting the technology. And that's what's going to help us.
Yeah. I love everything that you're saying and I completely agree. Spinning off of that, just going a little bit further with AI. I mean, you're obviously talking about the tools and applications that go into the health systems and specifically in your role, but also the AI utilization of these tools and technology. Is your organization adopting any of the tools or are you using them? Where do you see them playing out today and in the future when it comes to healthcare and informatics?
Yep, there is a desire to adopt. We'll put it that way for right now. I think we have a lot of prerequisites to make the EHR system we use. We adopted well before I even joined the organization. I think I had just started as a nurse when they adopted this particular EHR, and its development around artificial intelligence has significantly increased in the last few years, but there's a lot of foundational piece that we still need to do. So that's a technical piece. Is there a desire and need for it? Yes, I definitely think so. I think there are more regulations being put out that require us to be more preventative. And it's hard to be preventative when we don't know what's going on. Like, what's the data What are the trends? One of the AI examples that I'm currently investigating is the idea of fall prevention, fall detection, right? We have a lot of fall detection tools. We've had our pendants that have existed. We have our smart watches in which you fall, you get an alert, hey, are you okay? But where are we in preventing it? And I think a lot of the artificial intelligence that we start to see right now is, how do I do something? How do I fix something? It's kind of after the fact. But where can we get to with artificial intelligence to help prevent? And I think as we look at adopting AI in our particular organization here, we need to strategize it in a way where, yes, we can potentially use it to find things we need, but we also need it to be a little bit more forward thinking, right? Preventative, knowing that, hey, there's been a change in the trend of type of, the gait that the resident or patient has had. They're shuffling a little bit more. The gap between their steps is a little bit, it's off kilter. Maybe they're leaning one way over another. And we have a little algorithm that indicates that we have an increased risk of a fall, right? So that's the type of AI that our organization wants to look at. So it's more strategic. There's some, again, some prereq, but I think we're looking at adopting AI, but in a strategic way that allows us to be preventative rather than reactive. Both would be great, but I would love for it to be preventative right up front.
I love that. I actually haven't heard that. And I love that. It's always, how do we improve efficiency? But for you, you're like, how do we, improve prevention? Like, that's incredible. And who wouldn't want to hear that, for their loved ones or as a patient, that you guys are almost like 5 steps ahead. That's incredible. I love that, Patrick. So you are a professor now and teaching, giving back, I assume. How did you fall into that? How did you fall into teaching? And tell me more about Professor Patrick.
Sure, no problem. So many people ask, what do you do? I'm like, well, first of all, I'm a nurse. I'm a nurse by trade. And it's something that I have been trained to do and something that I've done for a long time. One thing that has always struck me as difficult is trying to explain who I am. I'm just going to scale back to one of our favorite sitcoms of the world, the Friends sitcom, Chandler Bing. No one ever knew what his role was, right? It was one of those things where it was, what does he do? I have no idea what his role is. So my first thought was, let's start educating the future of nurses so they're not completely blind on what this is. Because let's face it, day one, boom, EHR training, right? Oh, by the way, we have this, communication device that uses voice activation. We have this, we have that. It's a lot of technology. And nurses get into the world of nursing for nursing, not to use technology per se. So I figured if I can prepare them for understanding why it exists, they'll be a little bit more accepting of what it is and maybe even be more vocal on how it's used, it's designed to make the tools even better. So I did start that career about a decade ago at one of our Chicagoland universities, and I expanded it over to more of a nationwide university in which I teach an information systems and healthcare course for undergrad nurses. I've been at this particular university for 8.5 years. So I've been teaching this course for quite some time, anywhere between 40 to 90 students in a given 8-week session. So it can be a lot. But I think what I'm able to do is really share and showcase, yes, this is a career for you down, in the future, but also get ready to start using it. Get ready to be vocal, get ready to provide your feedback, because honestly, I personally wouldn't be successful in my job if I didn't have the nurses that I talk to. What do you need? What can make it better? Your experience means a lot. And as they understand it as students, now they can enter the workforce saying, I have a voice in this, let's make this better, because that's what's going to help us. So I've always enjoyed kind of giving that back to the students and showcasing some of that experience. I think they like the fact that I can bring in my experience. It helps them understand it and solidify the theory and the principles a little bit more. But I think it will prepare the nursing workforce of the future to be more ready, more available to accept the technology that can actually help them do their job.
I love it. And you're so well positioned because, like you said, you sat in the clinical seat, you sit in the informatics seat, you're doing it. So you're speaking literally from experience, and you're saying, I love what you said as far as, the training. So training has been a huge passion of mine, because when I started implementing electronic health records, 22 years ago, they were, whoever, the provider, the nurse, the front desk, they're sent to a class and then they're sent to go use it. And let's say you have a go live and maybe you have somebody with you for 2 days, or maybe if you're lucky, a week. And then they're like, good luck. And they were designed to see patients. They weren't designed to like use an electronic health record.
Right.
And so for me, my passion has become, how do we build training to make it engaging and memorable, and a library of resources, and micro modules where they can come back and quickly remember how to add the blood pressure or renew the medication or enter, the lab orders, and not having to remember it one time in a classroom, and that's it. And where they, whatever. What are some of the ways that you in your organization are implementing training tools to empower and inspire and engage your employees and the team at your organization?
Yeah, great question. And the reason why I say it's a great question is because it is quite night and day from my previous role and then this role. I think in my current role and within this market, training, onboarding is a bit more of a difficult aspect. And it's because of staffing. It's because of resource time and having enough people to actually do that job of continuously supporting. Yes, we do have technology support at every one of our communities across the 11 states that we have, but it's one item where I think there's still a bit of a struggle. So one way we are looking at doing that is finding quick snippet videos that are accessible for users for post-training, like post-onboarding type things. If you need a quick review, go to the resources tab, click on that, search what you need. You could watch it in 2 minutes, right? It'll give you a quick hitter. One thing that I do want to start taking a look at is adjusting how the onboarding is. I would like to see more, to your point, interactive. I want a lab. Right? I want a computer lab where you can sit down and actually do the clicking in a real world environment, a fake training type of environment, but one where you could explore, right, safely and adjust and learn and say, hey, what if I clicked here? If I did this, would it make it a little bit easier? That's the type of interaction that I would like to see in kind of the senior living market. It's a bit missing. And I think as a senior living market as a whole, we really don't see that level of training completely yet. Now, from an implementation standpoint, to kind of work with the background that you have a lot of implementation and training background. That's definitely something that we do hold close to our heart. One of my colleagues, she actually has her master's in education along with her nursing degree. So it is something that we work on a lot. Every implementation comes with a certain set of different ways we train. We have live training sessions. We have videos that are set up. We have FAQ documents that are ready to be sent out. And what I mean by FAQ, here are some nuances. If you need to do this, can I do this? This is how you do it type thing. And we also have a little bit of a command center, considering we are a national organization in, like I said, 11 different states. And most of the informatics team, if not all of it, is here in our central area. One thing we do are command centers. For every go live for at least a week, 2 weeks, here's a centralized number that you can call. You're going to get one of us. We will teach you how to do it. But a future thought of mine would be to have informatics trainers at every one of the sites, right? That can help manage those onboarding sessions. That can help, hey, if there's an issue, give me a call. I'll hop over and I'll show you elbow to elbow. Nurses, to your point, need that interaction. They need that hands-on type learning. We've always been hands-on. So I think if we can support that a little bit more, which we're looking to do, we're shifting our onboarding structures now, and we're looking to get more of that hands-on elbow to elbow, you're going to see a significant difference in usage, improved usage.
Yeah. And not only utilization, but also probably attrition, where they want to stay because they're learning and they know how to do their job and they feel inspired and they feel empowered. It's amazing. You train someone really well, they stay, and they want to, especially if the continual ed, even if it's just, hey, we made an upgrade, here's how to do it, versus logging onto a system and they're like, everything just changed. How do I do my job? Because it creates this like fear and this insecurity versus empowering them and inspiring them, and so then they are doing their job better. Nobody wants to ask for help, so when you have strategy, when it's strategically, you can train all the time continually, then it inspires.
And
Well, I know we're bumping up our, go ahead.
no, no, I was going to say that that's one of the things when it comes to that education, or because you just said or most people don't like to ask for help. I'm like, drop my title doesn't mean anything. I don't want anyone thinking just because it says director, you can't come knocking on my door, right? I'm one of those that would take the hinges off the door or take the door off the hinges and just kind of push it off. My title's gone. Ask me the question. Do not be afraid. I want to help you. That's the whole point. And we push that a lot. Just because we are, our headquarters central office, just because we have certain titles does not mean we're not here to help, because that's our primary job, is to be here to help. And that's definitely one of the ways that we help train and educate is doesn't matter if the director title doesn't mean anything. I want you to ask. Please ask. And that helps.
Yeah.
It does when they know that, there's that barrier is gone.
That definitely speaks to your leadership and the success that you've had and why you've had it, because you're willing to serve and say I'm available, but also, hopefully you have, the answers, but when somebody can approach you for those answers and they're not threatened, by, I don't want to sound silly or, that's amazing. I love that you're doing that. I think, like you said, take the hinges off my doors, like just come and ask. And that's what I always encourage everybody. Ask. You don't know, like, I don't know how to be a doctor. I don't know how to be a nurse. Like, I don't, but I do know applications. I do need EHR. I can help and I can make things easier. So it's like we all have our sweet spot, but wanting the desire to learn and not be insecure with it. So where is Patrick 10 years from now? Here, 20 years from now, if you were solving the world's problems or still in informatics or who knows, but what does that look like for you? I mean, you're obviously quite the leader, remarkable in the fact that we haven't even talked about, the publishing articles that you have, etc. But tell me, 10 years, what's happening?
A market force, I hope, right? And not meaning in a way where I am telling everyone what they need to do, but influencing what the best can be, right? Whether that is exactly where I am, whether that is, the ever growing chief nursing informatics officer roles that exist, whatever it might be, I want to be someone who can influence nurses to empower themselves to help create better ways to do things. Informatics isn't only just about the technology. It's about the processes. It's about the whys, the hows, the whos, right? It's taking all of it and creating this glorious system that works with technology as the help, right? It's helping us. So if I can be someone that can influence that voice of, well, we could do it better. What if we did it this way? Starting to really break out of that box, think outside the box. Don't be afraid to bring it up. Whether you think it's a quote unquote dumb idea, it isn't, because it very well could be that silver lining that shifts the market. So, for me personally, growth would be great, right? Anyone would love professional growth. But again, I want to be that influential market force where organizations want to talk to me to brainstorm, to think, where vendors come out to say, hey, what do you think? Can you take a look at that for me? It would be wonderful to get an opinion of someone who's been in the shoes of those clinicians on if this will work. Now, I will be asking for help too, right? I haven't been at the bedside for well over a decade at this point, but it's an influential market force is probably the best way I can say it. Where I'd want to be in the next 10 years is just someone who people can come to and say, what do you think? What are your thoughts?
Yeah, I love that. Going back to what, when I asked you, where is the market today and where do you think it's going to be? And you're like, there is a lot. There is still a lot that people need to know, that we need to learn, that we need to see and need to understand. And I don't think that every organization has taken the bull by the horns and hired a clinical informatics specialist, et cetera. And I think we'll get there. It's funny. Healthcare is so amazing, but yet it's so behind its times, and it's like we're trying to keep up, but I think just everything's moving so quickly that we need leaders. The healthcare space needs leaders like you. And I have no doubt that that's exactly who you'll be. And I think it's really exciting. And I'm excited to see the impact that you will continue to have on the population and improving patient care as a whole. If somebody wants to connect with you, should they find you on LinkedIn? What's the best way to connect with you?
I think LinkedIn is going to be a great way to do it.
Great.
I may or may not be the person you want to talk to. And of course, my background's on there. And if it's something that someone wants to talk to me about, what my thoughts are, or if I had experience in this, absolutely, they're more than welcome to reach out to me in LinkedIn and we can have some chats. I even have master students who sit with me every once in a while. I currently have a master student right now that I'm a mentor for. So there are different things that I do to try to really open up the world of informatics, whether it is nursing related, physician related, anything else, ancillary lab radiology. If they have a question, if they need some thoughts, if they want to have a chat, they're more than welcome to reach out to me on LinkedIn.
I love it. Well, I will make sure to include that in this and in the blog. And I'm sure, careful, I'm sure you're going to get plenty of inquiries wanting
That's
to
okay.
connect.
All
It's been a pleasure having you. I'm really excited to keep up with your journey and all the things that you're doing. So thank you for the time today, and thank you for your wisdom and what you are doing. I appreciate it.
I appreciate the offer and the invite to do this. This was very good, and I'm hoping that it really just spurs up this family of informatics in healthcare, so we can just make this better, right? That's what we want to do.
It's awesome. Every leader has a story, and every story reveals another piece of the bigger picture. What if the missing piece wasn't something you had to find, but something you were meant to become? Subscribe, share, and keep leading with intention. I'm April Reed, and I'll see you in the next conversation on The Missing Piece.